Michael, this first question from our audience is directed to you. Now, in your research that you've done, where you've looked at full-time employees working from home, is there a particular hospital organization profile that are more commonly had full-time employees wanting to work under this model or not?
As far as like an entire system or departments, because like when it comes to departments, basically our HIM teams have been probably the groups that led first in working remote. And kind of like what I was saying is it's really kind of that production model. So where if somebody's job is really to just rifle through a number of cases or encounters or bills for that matter, that's really kind of what we're looking for in any group that works from home, because we found that production-oriented people, they really don't like the socialization a lot. They do that kind of work because they do like to put their heads down and just knock out a bunch of work. And so given the opportunity to work from home, that seems to be a real benefit. I would say that leadership models, my entire team is actually remote now. So I run the revenue cycle for our ambulatory groups. So on the revenue cycle side, myself plus all my leaders, my auditors, my educators, we all work partly from home. So we have home offices, we have offices that we can go into at a corporate center to where we can have meetings or get together. But as far as an organization, really, I would say that it's probably the only thing that limits you is your creativity and maybe your technical abilities. I mean, obviously, if you're taking phone calls from a personal home, you have to have the ability to record those phone calls, technology to monitor somebody's desktop to where if they are showing performance problems to where you could remote in and see what's going on. We have caught people, putting people on hold and shopping, that kind of stuff. We don't do it. We don't spy on people. We use a very, upfront system that where if your productivity drops, we let you know that we're going to be looking at your desktop over the next week or things like that. Does that answer the question?
I believe it does. Thank you so much. Andrew, a quick question.
I'm sorry, I would like to add to that one. It works very well. Here at Moffitt, my team, Revenue Integrity, they have two options. They can work from home 3 days a week, or they can work compressed week. They have to be on site the whole week. That is a third week of the month. Everybody has to be on site because you have to have that collaboration as a team. And nice. It's working incredible. And you need to have that conversation with the team. We have the same form signed for HR, and they know that the business requirement, a meeting, something that's important, they have to be on site. It's working very good. My employee survey is very, very high. So if you plan it and you get their commitment, it can work for everybody.
Thank you so much, Jackie. Andrew, a quick question that dropped in during your segment. When planning for bot implementation, have you found in your experience that the people that are looking at implementing bots commonly overlook the idea of bot maintenance?
Yeah, I've seen, because I talked to a lot of different health systems about RPA, and I've seen a variety of responses. Some people recognize upfront that maintenance is going to be a challenge, and they want to ensure that they have a partner to assist. I've met with health systems who tried to go it on their own and build their own RPA teams and did not really plan for the level of maintenance that they were going to experience. And based on their experience, they then reached out to a partner to say, okay, hey, we know this is a good technology, but we've clearly stumbled or had some roadblocks, and we want a partner to come help us get through those. So I have seen that frequently maintenance is either an underestimated or an overlooked risk area within the revenue cycle for RPA deployments.